We started with the idea that we wanted to do health care for the underserved. Basically, we were seeing patients who came in with no money and no insurance, and our team, our residents, and our teaching program was taking care of them in the hospital. But about 1997, we said, you know what, we really want to be more out in the community to help take care of the patients out there in the community. And when we did, we actually found a vacant apartment in the housing complex, and that's where we actually started.
They give me medicine for everything that is wrong with me that is in their scope. And it's just been a blessing. And the fact that it's at my church, for some reason I come and if you got to see a doctor, you feel more comfortable in surroundings that you're familiar with.
But one of our major donors has said we really need to do this as a free clinic. We have a number of people who are like corporations or even foundations who've gotten behind us now and said this is really good care and we want to help sponsor and develop that. We have churches that get behind it because obviously going from one site at one location and seeing a few patients to 13 sites and over 7,000 patients in specialty clinics and 2 mobile medical vans, the expenses have considerably gone up. But one of the things we're trying to communicate to the community is it's about transformation. It's not just about giving out free health care. Free health care answers a question temporarily. Somebody's sick, you give them the medicine, they get somewhat better for the time. But what has it done to help transform their life from a challenged life or a broken life or a life that's in trouble to moving up to being a life that's whole, has real joy in it? I saw a patient that came in there who was about a 30-year-old African-American male who had several medical problems and severe psychiatric problems and had no work and just almost every social and difficult problem you can imagine. I saw that patient. I started the path towards can we get some medical care and everything. About 2 months or maybe 3 months later, came back and I was working on the van again, and this same patient came back in, except that when I saw this patient, I had to stop and ask some of the staff people, is that the same person I saw before? This person had now kind of gotten squared away spiritually, physically, was now actually going on part-time staff with the church, really getting their life turned around in a very dramatic way.
If I didn't have Good Samaritan to come to for assistance, I have to go to the emergency room, either St. John's or Hillcrest, possibly. That's what I have to do. I wouldn't have any other alternative if Good Samaritan wasn't here. It's just a blessing in my life at this time. It's from the heart.